vertigo and disequilibrium. The pathophysiology of vertigo. To coordinate vision and movement, it involves three systems: the vestibular system, the somatosensory system, and the visual system. These systems provide sensory input to the vestibular nuclei. This nuclei then creates two reflexes: the vestibulospinal reflex, which is used to hold postural stability, and the vestibulo-ocular reflex, which is used for visual stability. These two reflexes combine to create a healthy and functioning central nervous system, or CNS. However, a lesion in the system can lead to the wrong input into the vestibular nuclei. Wrong information is received by the nuclei, and therefore there are altered reflexes. Through this, it creates a misinformed central nervous system, which can lead to side effects like lack of balance, dizziness, and vertigo itself. The signs and symptoms of vertigo. The signs and symptoms include imbalance or dizziness, vomiting and nausea, and cold sweats. These symptoms are very vague, so sometimes doctors find vertigo hard to diagnose. It is important to mention all these symptoms during diagnosis, as there are many subcategories of conditions related to vertigo that could be misdiagnosed. The effects of vertigo on movement control. Vertigo has some serious effects on movement control. Postural sway or tilt is an example of the body attempting to keep center of gravity after the dizziness involved with the lesion in the vestibular system. Vision can become blurred or even shaky, confusing the brain into thinking that everything is moving around in the environment. This forces the body to adapt to the new perceived center of gravity. Head and neck tilt occurs as a compensatory action to postural sway and tilt in order to keep the body upright. This moves the location of the eyes to make for more difficult movement control. The movement of the head and neck, in addition to the postural sway and tilt, creates a harmful force on the body, as it is overcompensating in trying to keep the body upright as it perceives the environment as unstable. If the vestibular system does not calibrate the sensory input, what the eyes see as straight ahead could be slightly off and therefore affect movement patterns. The eyes can be a negative effect on movement patterns when they are not working correctly. The further the eyes are off being directionally calibrated, the worse the vertigo can be. Treatment and interventions of vertigo. A holistic approach of treating vertigo that involves physiotherapy, medicine, and cognitive behavioral therapy has been proven to be more effective than a strictly physical approach. There are many more aspects than first thought that relate to vertigo itself. It is therefore very important to incorporate all of these aspects into a fully effective prevention and treatment program. There are three main exercises that helped over 90% of test subjects recover, improve, or prevent their vertigo. These exercises are canalith repositioning, which is moving octonia, which are cells in the ear, to areas where it won't cause dizziness. It involves holding 4 positions for around a minute each. These 4 positions, as shown in the diagram, are laying down with head tilted at 45 degrees, tilting the head back up to 90 degrees, remaining in a supine position. Next, the participant lays on their side, tilting their head 45 degrees with the affected ear down, then finally sitting up and letting the head rest. The next exercise is a laboratory maneuver. It involves the patient sitting up with head tilted towards the side of vertigo. They are then laid down on their side, then promptly to the other side, and repeated often. As the purpose of this exercise is to get the patient side to side as quickly as possible, this, however, has to include rest at both positions and a slower transition so the vertigo does not get worse. The last exercise is the log roll. It involves starting on the side with the affected ear down. The patient does then a full roll, 90 degrees at a time. They are first turned onto their back, then their other side, and then face down. After the patient has completed a full roll, they sit up on the side of the bed and once again let their head rest.